Kesehatan lansia. Jangan tidur seperti ini jika tidak ingin stroke di usia tua. Kesehatan lansia. It is imperative, particularly for older individuals, to no longer underestimate the significance of sleeping positions. There exists a common sleeping habit that can subtly contribute to blood clot formation in the neck, ultimately leading to a stroke without warning. The most concerning aspect is that this habit often appears entirely normal, and many find it to be their most comfortable way to sleep. Many individuals believe that strokes occur abruptly, but the reality is often quite different. Strokes can develop gradually, built up night after night while we sleep. Over 2 decades of working with patients experiencing neurological disorders and strokes, a recurring and heart-wrenching observation has been the number of patients who arrive at the hospital too late. Families often express regret, lamenting, "If only we had known sooner," especially when initial complaints were minor, such as a stiff neck upon waking, a feeling of heaviness in the head, tingling in the hands, occasional slurred speech for a few minutes, or sudden blurred vision in one eye. These symptoms were frequently dismissed as normal age-related changes, simply a result of sleeping incorrectly, until a stroke ultimately occurred. The human body is remarkably adept at signaling potential issues, yet many individuals habitually disregard these signals. Even during sleep, the body is not entirely at rest. The heart continues to function, blood vessels remain active in circulating oxygen, and the brain continues its work regulating bodily functions. When the head and neck are held in an improper position for an extended period throughout the night, the flow of blood to the brain can be gradually compromised. The insidious nature of this problem lies in its lack of immediate pain or distress, leading many to believe they are perfectly healthy, unaware of the silent time bomb potentially developing within. When a blood clot eventually dislodges and travels to the brain, a stroke can strike unexpectedly upon waking. Therefore, understanding the most perilous sleeping positions for seniors, recognizing the signs of oxygen deprivation to the brain during sleep, and adopting optimal sleeping postures for unimpeded blood flow are crucial for maintaining health in later years. One particular case involved a 72-year-old individual who presented with a pale complexion and unsteady gait, accompanied by his wife. While seated, a slight tremor was noticeable in his left hand. He explained that he had almost been unable to wake up that morning, experiencing significant head heaviness and prolonged tingling in his left hand. Initially, his family attributed these symptoms to simply sleeping in an awkward position, a common assumption for older adults. However, his wife grew concerned as these episodes had become recurrent over several months. Occasionally, upon waking, mouth would appear slightly drawn to one side, his speech might be slurred for a short duration, or his vision would suddenly blur in one eye. What raised immediate suspicion was the consistent timing of these symptoms, almost invariably occurring immediately after waking. Further examinations revealed a serious narrowing in the blood vessels of his right neck, significantly impacting oxygen supply to the brain. Upon deeper inquiry, it was discovered he had maintained a particular sleeping habit for nearly 40 years. He consistently slept on his side, with his head significantly bent forward, propped up by 2 high pillows simultaneously. He found this position most comfortable, believing it prevented him from catching a chill and ensured deeper sleep. Unbeknownst to him, this posture exerted continuous pressure on his neck's blood vessels throughout the night. Our bodies possess major arteries, such as the carotid arteries, responsible for delivering oxygenated blood to the brain. The brain's dependence on a constant oxygen supply makes these vessels critically important. When the neck is excessively flexed for hours each night, blood flow slows down, increasing the risk of small blood clots forming gradually. The danger lies in the silent progression of this process. It does not cause immediate pain or collapse, leading many to believe they are healthy, when, in reality, their body is issuing a serious warning. When asked if he frequently woke with a stiff neck or a heavy head, he readily confirmed it, attributing it to his age. This is precisely what frequently occurs. Many dismiss all complaints as age-related, when in fact, the body is consistently signaling when something is amiss, but these signals are often ignored. The distress on his wife's face upon understanding the explanation was palpable. She remarked that his recent forgetfulness and unsteadiness likely stemmed from this habit. Fortunately, his condition was addressed proactively, averting a severe stroke. However, not all patients have the same opportunity. Some only seek medical help after experiencing significant paralysis, speech difficulties, or becoming bedridden, all often originating from seemingly minor nightly habits. The creation of this information is driven by a desire to prevent further instances of regret due to the delayed recognition of this danger. Sometimes what feels comfortable can silently inflict damage over time. After years of treating patients with strokes and neurological issues, a consistently saddening observation is the number of individuals who meticulously manage their diet, medication, and blood pressure checks, but completely overlook their sleeping posture. Certain sleeping positions can be significantly detrimental to blood flow to the brain, and surprisingly, these are often the ones perceived as most comfortable. The most frequently encountered problematic position is sleeping with the head excessively bent forward, typically caused by using excessively high pillows or curling up while sleeping. Prolonged forward neck bending constricts the blood vessels in the neck, impeding the flow of blood to the brain, much like a kinked water hose that still allows some water through, but with significantly reduced pressure. This scenario can unfold nightly in older individuals without their awareness. Initial symptoms might include a stiff neck, followed by a heavy head upon waking, tingling in the hands, or occasional blurred vision. Because these symptoms are mild, they are often disregarded, even though they represent the body's signals that the brain is receiving insufficient oxygen during sleep. Another highly dangerous position is sleeping on one's stomach. While some find it warmer and more comfortable, it compresses the chest, leading to shallower breathing and reduced oxygen levels in the body. Sustained oxygen deprivation throughout the night forces the heart to work harder to circulate blood to the brain, turning rest into an exhausting effort. A patient was treated who consistently woke up feeling weak with a racing heart, initially believing it was due to fatigue. The actual cause was sleeping on their stomach for decades. A third position, common among seniors who find it warming and cozy, is sleeping curled up tightly with the chin pressed against the chest. This can constrict the airway and impede blood flow in the neck, resulting in insufficient oxygen reaching the brain during sleep, explaining why many feel fatigued in the morning despite adequate sleep duration. Healthy sleep should leave one feeling refreshed, not with a heavy head and a weary body. A further dangerous yet often overlooked sleeping habit is dozing off on a sofa while watching television. The head is frequently held at an unnatural angle for extended periods. The neck may dangle off the edge of the sofa, or the body can be twisted for hours. While initially causing only mild stiffness, sustained pressure on the nerves and blood vessels in the neck over time can increase the risk of stroke. The most frightening aspect is that this often occurs without pain, as the human body is remarkably adaptable and compensates for disrupted blood flow. However, this compensatory capacity has limits. Continuous, gradual damage can eventually overwhelm the body's ability to cope, leading to a sudden stroke. It is crucial to pay attention to a vital aspect starting tonight. If you frequently wake up with a stiff neck, a heavy head, tingling in your hands, a general lack of freshness, or memory lapses, do not simply attribute these to aging. These could be critical warnings that your sleeping position is detrimental to your health. Remember, strokes do not always strike out of the blue. They can develop insidiously, built up night after night while you are asleep and unaware. A significant danger associated with impaired blood flow to the brain is the gradual onset of symptoms. These often do not immediately incapacitate an individual, leading many to dismiss them as mere age-related complaints. However, these are serious warnings. It is essential for individuals to carefully observe their physical condition upon waking each morning, as early signs of compromised cerebral circulation often manifest after a night's sleep. Symptoms such as a heavy head upon waking, a very stiff neck, tingling in the hands or feet for several minutes, intermittent blurred vision in one eye, feeling listless despite adequate sleep, or experiencing slowed thinking and difficulty concentrating in the morning should not be dismissed as normal. These could indicate that your brain is not receiving enough oxygen during sleep. In one instance, a 69-year-old individual from Bandung presented with increasing forgetfulness and frequent loss of balance while walking, sometimes experiencing dizziness upon standing up suddenly. While the family initially feared dementia, further examination revealed that the primary issue stemmed from poor sleep quality and years of incorrect sleeping positions. This individual consistently slept curled up with their chin touching their chest, finding it warmer and more comfortable. However, this position narrowed the airway and disrupted blood flow in the neck, resulting in suboptimal oxygenation of the brain during sleep. Adjusting the sleeping position and using a less elevated pillow led to significant improvement, with the individual reporting waking up feeling lighter and experiencing less dizziness. This highlights how minor adjustments can have a profound impact on overall health, as the body inherently seeks to heal and requires the right conditions to do so. Beyond head heaviness and tingling, another commonly overlooked sign is waking up frequently during the night with a racing heart or shortness of breath. While often attributed to nightmares or anxiety, it can indicate oxygen deprivation during sleep. When oxygen levels drop, the heart is compelled to work harder to supply the brain, leading to an elevated heart rate and sudden awakenings. Persistent occurrences can place a significant burden on the cardiovascular system and blood vessels. Furthermore, it is important to note changes in cognitive function. If you find yourself more forgetful, prone to confusion, experiencing difficulty concentrating, or easily irritable after waking, it could be a sign of the brain not receiving adequate oxygen over prolonged periods. This can lead to a gradual decline in cognitive function, and if left unaddressed, significantly increases the risk of stroke and cognitive impairment. Tragically, many only realize the severity of their condition when it is advanced, despite numerous subtle signals previously ignored. Therefore, starting tonight, it is imperative not to disregard your body's signals. If you consistently wake up feeling unrefreshed, it indicates a need for adjustment. Healthy sleep should be restorative, not further taxing on the brain. Prioritizing sleep quality is considerably simpler than facing the life-altering consequences of a stroke. After understanding the various sleeping positions that can jeopardize blood flow to the brain, it is now important to discuss the safest and most beneficial sleeping positions for maintaining health in advanced age. The positive news is that the body possesses a remarkable capacity for repair. While aging is inevitable, improving sleep quality is still achievable. Often, minor adjustments made nightly can yield significant benefits for the brain, heart, and circulatory system. Medical experience and numerous health studies suggest that the safest sleeping position for seniors is lying flat on their back, with the head aligned with the spine. This means the head should not be excessively raised or bent forward, but remain in a natural, straight position. This posture facilitates unimpeded blood flow to the brain throughout the night. Additionally, it minimizes undue pressure on the neck's nerves, allowing the heart to function more easily and promoting deeper rest. Many individuals make the mistake of using pillows that are too high, believing it enhances comfort. However, excessively high pillows cause the neck to bend for extended periods, potentially compressing the blood vessels in the neck. Conversely, pillows that are too low fail to adequately support the head. The ideal pillow should be of medium height, neither too soft nor too firm, ensuring the head remains aligned with the spine during sleep. A small pillow placed beneath the knees while sleeping on one's back can also be beneficial, alleviating pressure on the lower back and promoting overall relaxation, thereby improving sleep quality. One individual, 73 years old, accustomed to sleeping on his side and hugging a bolster pillow, initially found the recommendation to sleep on his back challenging. He expressed that it felt impossible to sleep that way. While initially uncomfortable due to years of ingrained habit, he was encouraged to gradually increase the duration, starting with 15 minutes and progressively extending it. His body eventually adapted. Within 2 weeks, he reported a noticeable reduction in neck pain and a lighter feeling in his head upon waking. Interestingly, his morning blood pressure also stabilized, demonstrating how sleep quality influences numerous bodily systems. Beyond sleeping position, sleep duration is equally crucial. Many seniors are now staying up too late, engaging in activities like late-night television viewing, prolonged phone use, or falling asleep on sofas. However, as the night progresses, the body's ability to undergo optimal restorative processes diminishes. It is generally recommended for seniors to aim for bedtime around 9 p.m. or no later than 10 p.m. This time frame aligns with the body's crucial regeneration phases, during which the brain clears toxins, cells are repaired, and hormonal balance is restored. Delayed sleep disrupts these processes, leading to increased fatigue, higher blood pressure, and a faster decline in memory. The habit of sleeping while watching television, though seemingly minor, is particularly hazardous, as it often results in prolonged, unnatural neck positions or dangling. Over time, persistent pressure on the neck's nerves and blood vessels can occur. Sleep is more than just closing one's eyes. It is the body's most vital time for self-repair. Therefore, comfort should not be the sole consideration. The sleeping position must actively contribute to better health. Implementing small changes tonight can potentially prevent strokes, preserve cognitive function, and enable seniors to enjoy their later years with improved health and independence. After absorbing the details regarding the potential dangers of certain sleeping positions, it is hoped that a greater emphasis will be placed on sleep quality moving forward. Many only recognize the importance of health when their bodily capabilities begin to decline. Regret often follows when individuals can no longer walk normally, speak clearly due to a stroke, or when family members blame themselves for not recognizing earlier warning signs. These issues frequently originate from simple habits: incorrect sleeping postures, prolonged neck pressure, or forcing the body to work when it needs rest. The senior years should not solely be about longevity, but about enjoying life with a healthy body, a clear mind, and the ability to remain independent with loved ones. The beauty of aging lies in being able to walk independently, share laughter with grandchildren, engage in prayer peacefully, and wake each morning without significant pain. These joys often stem from small, consistent daily habits. The human body is truly remarkable in its ability to self-heal, but it requires our support. Sufficient rest, correct sleeping positions, and consistent blood and oxygen flow to maintain brain health. A critical reminder is not to dismiss all complaints as mere signs of aging. If your body consistently signals issues such as a heavy head upon waking, a stiff neck, tingling hands, forgetfulness, or persistent fatigue despite adequate sleep, these should not be ignored. They may be the body's plea for help, The sooner we address our daily habits, the greater our chances of preventing more serious health problems in the future. Prevention is always far more effective than treatment. Strokes can occur in minutes, but their impact can alter a person's life for years. Therefore, do not wait until immobility sets in or until loved ones are in distress at a hospital. Start prioritizing your health now, beginning with the simple practice of sleeping correctly. Pay attention to your head and neck position tonight. Use a comfortable and appropriately sized pillow. Aim for an earlier bedtime. Avoid falling asleep on the sofa in front of the television, and ensure your sleep is truly restorative. Quality sleep not only refreshes the body, but also strengthens the brain, eases the heart's workload, stabilizes blood pressure, and supports memory retention in later years. Every senior deserves to experience their golden years with health and happiness. May good health, long life, peace of mind, and restful sleep be granted to all. Thank you for watching. If you found this video beneficial, please support the channel by liking, subscribing, and enabling notifications to stay informed about other important health information. As always, please share your age and city of origin in the comments. Your messages and greetings from across Indonesia are always cherished. Until the next video, stay healthy, live long, and may you always be under divine protection.